If you're just joining us, this will be in a webinar format, so we welcome everyone to enter their information or questions in the chat or in the Q&A box. And so we're going to kind of give everyone an intro to the Genie program tonight, and then we're going to hear from Genome Medical. We have Danielle Lemke, who is one of our genetic counselors with Genome Medical. And we also have Joy Aldridge. Hi, Joy, from the H&F team. And yeah, we are going to be introducing the CMT Genie project tonight, which we are very excited to be launching, and seems to be getting a lot of attention already with everyone registering for tonight's webinar. We know it's an important topic. One of the reasons why the H&F team put this together was because we really saw an ongoing trends in the CMT community. As patients ourselves, we know how frustrating and confusing the genetic testing journey can be. So we really wanted to put our heads together. We had a wonderful collaboration with Tara Jones, who is a genetic counselor at one of our centers of excellence at Cedars-Sinai. And we put together what we hope will really be a successful program to help eliminate the barriers to genetic testing for the CMT community. So welcome, Danielle, for joining us. Thank you for joining us tonight.
Counselors, I'm actually one of the genetic counselor leads at Genome Medical for the pediatric and rare disease team. And I've been with Genome Medical almost 2 years. It'll be 2 years like next month, I think. But I have over 10 years experience in genetic counseling. And so I work for Genome Medical, and Genome Medical is in partnership with the Hereditary Neuropathy Foundation in order to increase access, I would say, to genetic testing. So I'm here mostly as for support, but also I can talk more about genetic counseling later and what to expect with a genetic counseling appointment.
Perfect. And I'm sure we will be getting plenty of questions on that topic. So stay with us. But just to get started, we wanted to start with the CMT Genie website. So I'm just going to pull that up here on my computer, and we can show everybody what to expect on that landing page. All right, so if you go to cmtgenie.org, can everyone see my screen there? I'll make this a little larger. And so you'll be prompted to the homepage here. So next is a little bit about why to get tested. So we think the why is really a great place to start here. Why get genetic testing? Well, a lot of times similar conditions can occur and be misdiagnosed as CMT. So we think it's important to rule out the possibility of having another condition. Also, early interventions such as PT, bracing, things of that nature can be incorporated a little bit earlier. Dangerous neurotoxins can be avoided. If you have been following H&F and some of the organizations for a long time, you'll know that there's a neurotoxic drug list that we encourage everyone to have available to them, and make sure that that's something that you communicate regularly with your doctor and your pharmacist to make sure that you're not taking or prescribed any of those drugs. They can have anywhere from a mild to severe side effects for people living with CMT. And also your clinician can work better to predict your prognosis and your progression. Of course, CMT has a very wide spectrum of severity and symptoms, but it is good to have at least some prognosis and what to expect, and symptoms and things like that. Also, you can find support for family planning. The inheritance pattern varies from CMT from the different CMTs. So it's really important if you are thinking about starting a family and you have a lot of questions around that, it's really important to get tested and to find out what that inheritance pattern looks like for you so that you can plan accordingly. Also, there are some really exciting clinical trials happening, and we are doing our best at HNF to make sure more of those are happening as quickly as possible. But once you know your type, you have a much better chance of being enrolled in a clinical trial. And many of the clinical trials require an official genetic diagnosis in order to participate. So that's another great reason. So that's just a little bit of background on why to get tested. And how does it really work? Well, there's a series of questions. So we try to make this as user-friendly as possible. And it just really starts with these 3 questions here. Yes, I have a clinical diagnosis of CMT. I have a family member diagnosed with CMT, or there's still some uncertainty on whether or not I have CMT. So each one of these is a toggle. You'll just click on that and you'll go to the next answer. I have a clinical diagnosis. Yes, I have had genetic testing. No, I haven't. And that'll take you to the next screen. I have a clinical diagnosis. I've never been tested. Do I qualify for sponsored genetic testing? And here are some of, here's a little bit about the sponsored labs. And this is something that we're working very closely with Genome Medical on. And all of these different, depending on your current status, your current scenario, these are all going to look different for everyone. But there will always be this option here, book a call. And what that does is that takes you directly to the HNF calendar link, where you will be able to make an appointment with the HNF team so that you can speak directly with us. And the advantage of that really is, as we get to kind of hold your hand during the process, it can be very confusing. And even when you get a prescription from a doctor, there's still some uncertainty whether that doctor is qualified to translate those genetic reports to you in a way that makes sense to you. There may be some other conditions or symptoms that you're struggling with at the moment that HNF can connect you to resources about. So we love this. We love this personal touch that we've incorporated into the Genie, because it lets us speak one-on-one with you and make sure that we are sending you to the right lab, because there are some labs and some types of CMT that are newly discovered. SWORD is an example of that. And so there's a lot of labs that are not testing for SWORD. If there's something in our conversation that leads us to think that you might possibly have this type of CMT, we're going to make sure that we connect you with the right labs. And sometimes those can be sponsored, other times they're not. So we think this is a great way to really help ease our community into this process. And so from there, if you do qualify and if you do want to move forward with genetic testing, this is where we connect you to Genome Medical. And this is where counselors such as Danielle and the rest of her team will kind of lead you through that initial genetic counseling session. So Danielle, do you want to kind of introduce us to what our members can expect from that initial virtual consultation? And we should say, as a quick disclaimer, this does not require a prescription from a doctor. This is one of the ways that we're trying to remove barriers. A lot of times our patients don't have access to a neurologist. There's a long waiting list. And so this, we felt, was another great option to accelerate the whole process. So Danielle, yeah, give us a little bit about the introduction of what we can expect from Genome Medical. Oh, I think you're still on mute. There we go.
Yep. Okay. And you can see my screen.
Yes, perfect.
Perfect. Yes. So this is where I come in with the Genome Medical part. And we, like I said, are partnership with the Hereditary Neuropathy Foundation to help facilitate this genetic testing. So this is going to be a brief introduction to Genome Medical and how genetic counselors can help with the genetic testing process. So first and foremost, Genome Medical, and that is who I work for. And so we'll talk about them super quick. And I already kind of introduced myself, but there is my headshot. I don't look like that today. I actually have COVID. Yeah, but it's fine. It's very mild, and that's a benefit from working from home. But yes, I am one of the lead genetic counselors, have over 10 years of experience, mostly in pediatric and rare disease. And anytime we talk about things at Genome Medical, we always provide this disclaimer just for information, I would say. So this webinar constitutes general information about genetic testing and medical screening. This webinar does not offer or provide medical advice or diagnosis, and nothing in this webinar should be construed as medical advice or diagnosis. Do not rely on the information in this webinar to make medical management decisions. Please consult with a medical professional before making those decisions. Do not delay in seeking professional medical advice if you think you have a medical condition. And do not disregard professional medical advice based on any information received in this webinar. So now that we got that out of the way. So like I said, I work for Genome Medical, and Genome Medical is a virtual genetic clinic providing comprehensive telehealth services specifically for genetics. We provide genetic services for individuals, but also for health systems and medical practices. And our goal is to ensure that all populations have access to genomic health data. And lastly, we are innovative in digital health to help increase access to genetics by using a bunch of different technology and technology-driven innovation. We have well over 60 clinicians averaging 10 years of clinical experience. We provide services to all 50 states. And typically individuals can be seen within 48 hours of when they are interested in scheduling a visit. Our clinicians specialize in a variety of areas, including neurology, which I know is the area for HNF, but also rare disease and pediatrics, cancer, cardiovascular, proactive genetic testing, reproductive genetics, and pharmacogenetics. We utilize a telegenomics platform to provide easy access to genetic expertise and services. This is particularly helpful for people living in rural locations without easy access to genetic clinics, or if they live in an area where genetic clinics have a substantial wait time to get in to have an appointment. We are able to offer phone or video consultations, so people can have their appointment wherever and whenever is most convenient for them. And next, I'll talk about what genetic counselors are and what they do. So at Genome Medical, everything we do revolves around the person or the patient. We have a comprehensive care team that includes genetic counselors, medical geneticists, pharmacists, primary care physicians, care coordinators, and genetic counseling assistants. Genetic counselors, though, are kind of at the center of the slide, and they integrate genetic expertise, science and counseling backgrounds, and education into their daily interactions with patients or individuals. So technically, a genetic counselor is an advanced trained medical professional who can help determine if there is a genetic condition in you or your family, what that genetic condition might be, the best way to test for it. And throughout this, they assist with discussing medical decisions, which may include to pursue or not pursue genetic testing. And if you choose to pursue genetic testing, when the results are available, a genetic counselor helps explain the test results, what they mean, and the implications for your health or other family members' health. Genetic counseling is the process of helping people understand and adapt to the medical, psychological, and familial implications of genetic testing results. Okay. So what this means in practice is genetic counseling is a discussion and an information process, and most importantly, with no pokes. Genetic counselors are familiar with the common but also rare genetic conditions, and typically rare is defined as less than 1 in 200,000 people. Genetic counselors translate complex medical terms into usable or helpful information. They can provide assistance with decision-making and empower you to make decisions. One important consideration is genetic counseling can be completely independent of genetic testing. You are not required to proceed with genetic testing if you have a genetic appointment or see a genetic counselor. And sometimes genetic testing is not recommended either at all or particularly for that individual, as it might actually be more informative to test someone else in the family. Genetic testing is a personal choice that involves consideration of multiple factors, such as personal comfort level with wanting or not wanting to know information, family member considerations, and even cost. Genetic counselors also have cultural competency training and awareness, and typically have access to interpreters. One little caveat, though, is particularly for Genome Medical genetic counselors, we cannot currently see families outside of the United States due to licensure restrictions. However, there are genetic counselors in Canada and many other countries, so there still are some access outside of the United States. And then this is what to kind of expect with a genetic counseling appointment. So every genetic counseling service or clinic is a little different in the process, but generally, you will typically schedule or be scheduled with a genetic counselor and be asked to complete a survey or questionnaire ahead of time, so your genetic counselor knows why you're coming to the appointment and they can prepare for your visit. The duration of your appointment can be anywhere from 30 minutes, an hour, 2 hours. It's depending on who you schedule with, but how long you should expect to meet with a genetic counselor should be communicated to you when you are scheduling your appointment. Particularly at Genome Medical, we have 30-minute appointment slots. During your session, your genetic counselor will tailor the appointment to you and your concerns. And together, the goal is that you will agree on goals for the session, discuss your personal and family history, review risk information and how the suspected condition is inherited, discuss options for testing and billing, review laws surrounding genetic discrimination, and plan for how results will be communicated to you. That's if testing is pursued and ordered. After your appointment, you will typically receive a written summary of what was discussed and the plan going forward. When your test results are available, you are typically scheduled for a follow-up appointment, or your test results are sent to you, typically with a results letter, including any other information pertinent to your results or situation. Sometimes this may include a family letter to help inform relatives of the information, or clinical trial information particularly related to your condition or the gene that you tested positive for. And I think that's about it that I had. So I will open it back up to questions or anything else Estela wants to talk about.
Yeah, so let's thank you for that. Thank you for that introduction. I know it's a lot of information for everyone. So we want to just reassure that this is why the CMT H&F team really would love to support our community on the calls and as much as possible, because it can be overwhelming. But just going back to the actual process. So I come to you, I'm interested in getting a test. And so if I have insurance, what's like the typical cost involved for someone who has health insurance and wants to start with Genome Medical, and also what do most insurance companies cover genetic testing? And of course, we are working as much as possible with Invitae and other sponsored labs to make sure that wherever free testing is available, we are gonna make sure that's a top choice there.
Yes, great question. So first and foremost, Genome Medical has a lot of insurance contracts. So when you're making a genetic counseling session or making a genetic counseling appointment, you can most definitely use your insurance. And a lot of insurance companies do recognize genetic counselors as providers, and they can bill to insurance. Worst case scenario, if it is self-pay, there is a bundled rate. I think it's $159 off the top of my head. Was it 129 or 150?
125.
125. I don't do a lot of the billing at Genome Medical. But yes, there is the self-pay option, or there is, like I said, you can use insurance for the actual genetic counseling session. And then as far as genetic testing, we do try to use the sponsored testing programs, particularly at Invitae. There's also some other labs who have sponsored testing, where the testing would essentially be free of charge for individuals who meet that criteria for the sponsored testing program. If that individual does not meet criteria for the sponsored testing program, a lot of labs, Invitae in particular, cap their self-pay at $250. Worst case scenario, oftentimes it can be less than that because they do have financial assistance programs. So a person can do insurance and then, or sorry, self-pay, and then there's always the option to check insurance first to see if insurance would cover the cost of testing or not.
Right, perfect. And there is, sometimes there's a copay, even if you do have insurance, which is around like an average of $50, I believe. Is that correct?
Yes.
Okay.
Mm-hmm. So I know that maybe upfront they typically do collect the copay, but then yes, in the genetic counseling session for sure can be billed to insurance. And then for the testing, the genetic counselor can usually determine if the individual meets criteria for the sponsored testing. And then if not, it's typically the lab that checks insurance for the actual genetic testing, and then lets the person know their estimated out-of-pocket cost, and they can go through insurance or they can do the self-pay.
Great. And I know one of the requirements for the sponsored testing is 18 and over, but there are ways to also test family members under the age of 18 under that sponsored testing, right? If the family member tests positive for CMT, I believe it's within 150 days, they can have a family member tested at no charge.
Yes, so that is an Invitae lab policy. If a person tests positive or has a pathogenic or likely pathogenic variant on genetic testing, they offer free of charge follow-up family member testing for 150 days from their relative's original test report date.
Awesome. And is that something that Genome Medical can help to organize?
Yes. So let's say you had we saw an individual and they tested positive for one of the forms of CMT, and let's say it is one of the forms that can have earlier onset and it's appropriate to test someone under the age of 18. The genetic counselor at Genome Medical can help facilitate placing that specific order for that specific genetic change, and coordinate the testing for the individual under the age of 18, or really any other family members. Mm-hmm.
Excellent. And then just going back, most of the labs send an at-home test kit, correct? So it's a saliva kit. So that's another great part of this, is that you don't have to travel to get the testing done. Most of those times the saliva kit is viable. And then in the small chance that it isn't, the lab can send someone to your home to draw blood. Is that correct?
Correct. So nowadays, doing genetic testing on a saliva or a buccal swab, so like a cheek swab, is kind of standard of practice now. With a bunch of different clinical studies, they have found that you can actually find more genetic changes in saliva versus in your blood. It's kind of a other tangent. But we typically have the lab send a saliva or buccal kit to the family, and they can collect the sample in the comfort of their own home. There are instructions in the kit on how to do that. And then the lab typically has a prepaid return label. So the family would just drop the kit off at like a FedEx location. And so we try to do saliva, and then the lab has like quality control measures as far as if there's enough DNA in the saliva sample, and if the saliva sample is contaminated or not. If the saliva sample does not pass their quality control measures, we typically try a follow-up saliva sample. If that doesn't work, then yes, we can go to a blood sample. And so the lab would send a blood kit to the family, and Invitae has a mobile phlebotomy service. So the family could schedule a blood draw specifically through Invitae for their mobile phlebotomy. Or in other instances, we have had individuals take that blood kit to a blood draw location somewhere that's close to them. But in either instance, doing saliva or blood, getting the kits to the family is super easy. And getting the sample is something that Invitae helps coordinate as well.
Perfect. Thank you for that. And then as far as Medicare and Medicaid, is that something that covers the counseling and or the insurance, the lab testing?
Yes. So, excuse me. So for the genetic counseling, sometimes they recognize genetic counselors and sometimes they don't. So usually I think it's Medicare. Medicare typically does not. Just with the billing that they have, they don't recognize genetic counselors as independent providers. However, with the genetic testing, typically we can try to get it done through Medicaid or Medicare if we can't do the sponsored testing program. And then kind of as a backup to that, sometimes the labs have no balance bill to Medicaid or Medicare patients. So there's kind of also that. But Medicare does cover testing, but we always have the lab check insurance anyways.
Okay, so it's good to do your homework a little bit on that and work with a representative. And for people who, I know a lot of times they've had genetic testing in the past, and this is something that we addressed in the CMT Genie on the homepage through that answer key. But for those that are on today, they've had testing maybe 6-7 years ago, maybe even longer, and there wasn't a definitive diagnosis. Is that something they should try again now, or okay?
Yes. So if you were to make an appointment with a genetic counselor and you had genetic testing previously, it's strongly recommended that you upload a copy of your previous genetic test results. At least at Genome Medical, we have a patient portal.
Right.
It's strongly recommended that you upload your previous genetic test results so your genetic counselor can review what you've had already. Typically, as like a general rule, if someone has had genetic testing 3, maybe even 5 years prior, a lot of times the genetic testing and the panels have changed as far as like the genetic content that is on them now. So if a person hasn't had testing within the last 3 to 5 years, typically a genetic counselor will recommend repeating that testing or having an updated lab that updated panel, just because we're continuously finding new genes or new reasons for genetic conditions, and CMT and neuropathies are definitely a part of that, where there's new discoveries all the time. So yes, if someone's had an inclusive or kind of undiagnostic result previously, that's something the genetic counselor reviews and may recommend updated testing.
Okay. And what's the protocol for someone who gets tested now and it still comes back as inconclusive? What are the next steps for them?
Yep. And that happens fairly, I would say fairly not uncommonly. So anytime you do genetic testing, particularly if you do a panel test, which is what the majority of genetic tests are these days, there are 3 main result categories that can come back. It can come back completely normal, which would mean the lab didn't find any changes in the genes compared to the general population. Opposite of that is it could come back pathogenic or likely pathogenic, which could mean a diagnosis, and then the individual's medical management may change in accordance with the recommendations for that condition if they're not doing them already. And then the third category of result is called a variant of uncertain significance, or basically an unknown or a big question mark. And one of the benefits of seeing a genetic counselor is we are trained in kind of analyzing variants of uncertain significance, and your genetic counselor can tell you how suspicious they are of that unknown variant versus not. And so if it's something where the variant is pretty suspicious and the lab just didn't have enough information to kind of just push it over that threshold, your genetic counselor may recommend that you more or less treat it as like a likely pathogenic or pathogenic result. There are other times where variants of uncertain significance are just big question marks, and they're really not going to change medical management at all, and it's more of a wait and see. And so usually in that instance, most labs do a curation of their data every 6 months to see if they would update any variants of uncertain significance. But we typically recommend people check back in with their ordering provider for that lab where the VUS came back. Usually check in in about a year if they haven't heard anything different. And if it's one of those unknown results where we're really not suspicious about it, or we really don't know much about it, typically there's no, like I said, no changes to medical management, and it's more going back to your neurologist for management just based on your symptoms. But with the recommendation to check back in to genetics in about a year if you haven't heard anything from your ordering provider in that interim.
Right. And maybe Joy, you can touch upon this. There's H&F is working hard to make whole genome sequencing more available as well, to find those very rare types when they are not included on the neuropathy panel. And someone had a question regarding the testing. Are they testing just for CMT, or is it a whole test for all diseases? Can you elaborate a little bit on that?
Yep. So the sponsored testing, the one that we typically use the most is the hereditary neuropathies panel, or the comprehensive neuropathies panel at Invitae. And that core panel has 102 genes on it. So it for sure has the CMT genes on it, but it also has motor neuropathies or sensory and autonomic neuropathies on that. So it can kind of catch overlapping symptoms. You brought up a good point as well. So usually we start with panels because you have the highest likelihood of, if you have a clinical suspicion for some type of condition, you have the highest likelihood of finding something on a panel, which is specifically for that condition. But there's always the option to reflex or go to broader testing, such as whole exome or whole genome testing. Typically we go to whole exome now because it's covered by a lot of insurance companies, whereas whole genome is not. But for sure, there's that option to go to the much more broad testing in case there is more of a novel neuropathy gene that isn't included on the panels at this point in time.
Right. Yeah, no, I think it's important to kind of keep that in mind, that just because you don't have a definitive diagnosis, that there's still more room to explore. And that's another reason to keep in contact with the H&F team so that we can do our best to connect you with those resources as well. And, you know, in addition to all of the great benefits that it offers to our community, as we get more genetic diagnosis of CMT among the population, and people are really learning what types they have, that really has the power to drive research faster and further. So I'm going to hand the mic over to Joy Aldrich, who runs our who's our GRIN advocacy director, and you could tell us a little bit more about how the genetic testing and our research are kind of meeting in the middle there.
Yeah, thanks, Estela. So my name is Joy Aldrich, and like she said, I am the registry coordinator for the Global Registry for Inherited Neuropathies, or GRIN. And what we do is we collect information from you on our website. It's listed right on the top menu bar. You complete some surveys about your symptoms, your diagnostic journey, any comorbidities that you might have, any issues that may have caused your CMT to get worse. Just all these types of questions that researchers are asking when they're trying to characterize CMT. So it's a really important database for you to join if you haven't done so already. We will be relaunching a new version of GRIN in the coming weeks, so keep an eye out on your email for the launch of that, and please join us by participating in research and entering your answers to these surveys. And if you do take advantage of the CMT Genie program, the counseling and the testing, we would love it if you would come back afterwards and upload that genetic report so that we can tie your type of CMT to the symptoms and your diagnostic journey, all those things that I mentioned, tie it all together so we can very easily characterize CMT1 versus CMT2. All of this information is really important for research and for industry as they're designing clinical trials and looking for ways to treat those people living with CMT. So keep your eye out. Please join us in GRIN and upload your genetic reports.
Yes, thank you. Thank you, Joy. I mean, we don't realize as patients how important that information is. I know everybody kind of rolls their eyes. Oh, another survey. I've filled out all this paperwork at my doctor's office. That's not what we're doing here. It's really, we're giving the power back to the patients to drive the research, because when there's a certain type of CMT that affects people in a certain way, a clinical trial has to be designed in a way so that those symptoms and those biomarkers are addressed, and we need to measure them to see where we are before the trial starts and then after the trial starts to really validate it as an effective therapy and treatment for CMT. So it's not as fun as some of the other things that we get to do here, but it really is super important. So when everyone sees those emails come through their inbox with GRIN and the launch announcement, we really encourage everyone to take part in that. It's just a really easy way for us to move things forward more quickly. I know we had a few more questions here regarding the testing. In the instance where maybe a father or a parent has been already diagnosed with, let's say, CMT1A, and now they have young children that they want tested, does that still fall in line with the sponsored testing, or at that point would they have to kind of go through their insurance again and have their children tested through the insurance?
So in that instance, we would want to originally do testing in the father to get an underlying genetic diagnosis. And then based on what the genetic test result is, then we can coordinate testing for other for other relatives and potentially children. So the father in that instance would likely qualify for the sponsored testing. We would do the panel, see what comes back, and if it does come back diagnostic, then we can talk about testing or doing site-specific testing for the children.
Okay. And even if he's been tested, let's say 2 years ago, and he already had genetic testing, is that change?
So, yep, that's a little bit different of a situation. If he already had outside genetic testing somewhere else and has a pathogenic variant, we could then coordinate testing probably through insurance, because if they're under the age of 18, they won't meet the sponsored testing program requirement. So usually insurance or self-pay at that point.
Okay.
For children. And sometimes with children with adult onset, for the most part, conditions, sometimes there's a discussion about waiting until a child has symptoms or the benefits and limitations, I guess, of doing genetic testing in an asymptomatic child. So that's also part of like the informed consent and that sort of discussion that happens with a genetic counselor.
Right. Yeah, no, there are things to take into consideration. And of course, everyone's decision is based on their own experience. Is there a limitation to the amount of family members that can be tested in correlation with the sponsored testing? And what does a family member, how is that defined? Is it immediate family member? Is it a first cousin, an aunt, or an uncle?
So I'm going to caveat this with, I don't work for Invitae, who's the genetic testing company. But my understanding is for pathogenic or likely pathogenic results, there is not or should not be a limit for the number of relatives that are tested off that original patient's results. So anytime you do genetic testing through Invitae, your result has like your name, date of birth, a bunch of demographic information, but then like an RQ number. And so when a person is placing orders for family variant testing, it's based off of that RQ number that the original individual had. So to my knowledge, there's not a limitation for family members, and it doesn't really matter what family member you are in relation to that person. There's definitely more informative individuals to do testing for versus others in the family. But their one kind of restriction is the 150 days from the original test report of the original person that was tested.
Okay, that's good to know. And then as far as the privacy of the test results, that just goes directly to the patient. It's up to them whether or not they'd like to share that with their healthcare provider. And for the patient registry for GRIN, that is completely private. And the genetic reports are de-identified on the researcher's side of it. So no one has access to your genetic report. And we're very cautious about that, obviously, because they're still concerned about employer discrimination or insurance discrimination and things, unfortunately, that are still happening. So we're very much respectful of the privacy of those tests as well. And then we had someone here ask, you know what, I think Patsy had her hand up. Patsy, if you're still available, I'm going to put the mic on for you. Did you have a question that hadn't been answered yet? All right, she may have left us there. Okay. Is there an age limit? I know there's the minimum age of 18, but is there an age limit for the testing?
Nope.
Okay.
Nope.
Good to know. I know there are age limits in the clinical trials, so that's a separate area. But for the testing itself and the sponsor testing, there is no age limit. Okay, so Arlene had a question here. She has a clinical diagnosis of CMT1A and EDS. I no longer have a doctor to order tests, so this help is needed. So that's more of a comment. And then she asked about Medicare. Would they cover more than just the CMT panel? She has a limited income.
They might. We can always see what insurance covers. And then if there is no insurance coverage, there is kind of always that fallback of the max out of pocket being $250, potentially much less than that if you ask about like the financial assistance program that they have and Invitae. So we always try with insurance and see what happens. And if not, there kind of is kind of that capped max out of pocket fallback.
Okay. Well, I think it's great that you work so closely with the patient to figure that out, because it can be very overwhelming and intimidating to try and find out what your options are. We had another question here. In 2017, an individual had a gene diagnosis, hereditary neuropathy, 3 panels, a hereditary neuropathy panel. The last panel had a test for PMP22 gene, and they only had 1 variant. Does the PMP22 have to be positive to go further with CMT testing?
Nope. So PMP22 is only one of the genes that we know can cause CMT, and there are a handful of other genes that can cause CMT. So most definitely that one does not need to be positive in order to do genetic testing. Since it wasn't positive, it would actually be an indication to do more broad genetic testing for the other forms or other genes that can cause CMT.
Okay, so yeah, that's definitely something to pursue. We had another hand raised here. Rebecca had a question. Let's bring her up on stage. Rebecca, are you still there? If you are, can you unmute yourself, please? Okay, I guess not. We had a question here from Linda. Do you just email to
Oh, I'm sorry.
Do you still have a question?
Yes, I'm sorry. Can you hear me now?
Yes, we can.
I was wondering, I know with genetic testing I've had in the past, they have covered medications, and with CMT, with the Genome Health, I was wondering, I understand y'all are covering so much already, but does it, or do you offer another one that would help with that? Like my son-in-law has trouble taking pain medications, but he needs them. And then my grandson definitely has it. He's sick. So I just wonder about medicines with the testing.
So there's kind of twofold to this. So there's first part is doing genetic testing to see the underlying genetic reason for the CMT, and then if that confirms the CMT, kind of like we talked about before, there's the contraindications for some medications. So there's that part of it. Kind of unrelated, but kind of not. There is the option of pharmacogenetic testing now. And sometimes doing the pharmacogenetic testing can say either a certain type of medication, particularly pain medication, may work better than others, or some would be expected to have more adverse side effects than others. So kind of like I said, it's kind of twofold. I think first and foremost, identifying the underlying genetic reason for the CMT. And then kind of a little bit broader than that, just with medications and genetic testing in general, there is that option for the pharmacogenetic testing.
And is that something that Genome Medical helps support them in? Excellent.
Yep. So if someone came through this process and they wanted to do testing for CMT or the other forms of neuropathy, and also had a question or concern about pharmacogenetic testing, that could also be addressed.
Excellent. Well, thank you for that question, Rebecca. I'm sure There's a few others with that question as well. Let's see. Joy, are there any other?
Yeah, there was one that I saw. It says in the Genome Medical website, neurology or neuropathy is not listed as your specialty. I guess they are explaining to the neurological conditions, or is it specific to CMT only? So Danielle, your team's been trained on CMT.
Yes, so there should be an option when you schedule an appointment to schedule under neurology. You can also do an adult other, but it should be neurology. And any of the genetic counselors that see patients under that category or affiliation are very well trained and versed on CMT and the neuropathies. And I think I saw a question as well. There was a question about like myopathy as well. So that too. And they've also have been trained on this affiliation and the work that we're doing with the Hereditary Neuropathy Foundation. So I think if you go through the neuropathy option at Genome Medical, you will be in excellent hands with any of the genetic counselors that see neuropathy patients.
Yeah, and those are some of the things that we can catch as well in our intro call with the H&F team. And Joy, maybe we don't have to mention names, but maybe you can kind of touch upon the individual you spoke with on our first appointment. One of our first appointments, just the way that the conversation kind of sometimes flows. Yes, a lot of individuals are looking for support with the genetic testing, but they're also struggling with, pretty serious symptoms. So maybe Joy, you can share a little bit about that. And
yeah, it was Estela's idea that we conduct these pre-screening calls with the H&F team, speaking directly to the people that are looking to take advantage of the genetic counseling and testing. And one of the reasons is obviously, we'd like to be able to help in other ways. And we were having a great conversation about genetic testing and about how to get signed up for the genetic counseling appointment. And as we were wrapping up the call, she mentioned that she was having trouble breathing and that her oxygen levels were going down into the 80s. And that the treatment that she was being offered was pure oxygen, supplemental oxygen. And if any of you have a weak diaphragm, you know that you should never have supplemental oxygen without ventilation. And so we were able to have that conversation, and I was able to put her in touch with a pulmonary doctor near her that specializes in neuromuscular disease so that they could understand the difference between basic sleep apnea and a weak diaphragm that's going to require probably BiPAP support. So there's so much more that we want to talk to you about, more than just the genetic testing. We've got a lot to offer and want to get to know you. So Estela, it was a great idea that we do these introductory calls.
Yes, excellent team effort. Does anyone have any other questions? I'm trying to make sure that we, as we wrap up here, that we have enough time for everyone to ask their questions.
And if you have questions that you're not asking, go ahead and just start at cmtgenie.org and book an appointment with us, and we'd be happy to answer your questions.
Yep, no cost for the appointment. We are more than happy to help you and connect you with resources, events, Facebook groups, support system. It's we really believe in a holistic approach to living with CMT, and we know that it doesn't end or start in a doctor's office, that there's so much to it. So we really do our best to try and support each other that way. But yeah, we really appreciate you taking your time, especially with COVID, Danielle. I'm so sorry you're going through that. But
what a trooper.
I know. Thank you. Such dedication. We hope you get some rest soon and recover quickly. And we hope everyone checks out cmtgenie.org. And like I said, just takes advantage of the services that we have there. And feel free to reach out to us with any other questions you have around genetic testing. So yeah, thanks so much. This is being recorded and it will be up on our YouTube channel in the next few days. So we will be posting that for anyone wasn't able to join for the full webinar or would like to watch this again or share it with a loved one, that will be up soon. So thanks again, everyone, for joining, and have a great night.
Bye, everyone. Thank you.
Thanks.
you.
Bye.
Danielle.